This is One on One. Welcome to One on One. I'm Steve Adubato. Back by popular demand, we have our good friend Stephen Jones, who is the president of Robert Wood Johnson University Hospital and the newly named, as we do this program, chairman of the New Jersey Hospital Association, which is a very big deal. So you put in perspective what the Hospital Association is and what the chairmanship really means. It's a big platform.
Yeah. Steve, New Jersey healthcare providers, we're a densely populated state with unique needs, major urban centers, rural centers. As you know, healthcare in our country is changing, and the Hospital Association helps to support its members for promoting wellness, improving quality, improving value. It's a big responsibility. We have great healthcare providers in New Jersey.
What are you facing? I mean, the association is so interesting because Betsy Ryan has been there, the day-to-day person running the operation. When I talk to Betsy, I often think, my God, what a diverse group of members. You know, as you said,
sure.
Urban, suburban, rural. You're an association, but you have diverse interests.
Well, the patient and the community are our main interest, and if we focus on those, we can always find strategies for improving wellness.
Is that the common bond?
That's the common bond. And we also, the association represents post-acute providers as well.
Put that in perspective.
So it's acute care hospitals, children's hospitals, teaching hospitals, long-term care, assisted living, all along the health continuum. The New Jersey Hospital Association is there to support its members.
And the other thing with Steve is that with our partners, we're very much connected to the Edward J. Ill Awards. Every year, Dr. Edward J. Ill, who passed many years ago, but there is an event every year that's held in his honor. He was a great, not just physician, but medical educator, and every year there's an award series that's held, an award event that's held with our partners at MD Advantage. And you won the Medical Executive of the Year award, the Hospital Executive of the Year. I mean, you were the person. Very competitive situation. What did that mean to you?
I was humbled by it. I don't know that I deserve it, but when you look at the legacy of great healthcare leaders that we've had in New Jersey, I'm proud to join that list.
Pakistanti and the whole team at MD Advantage, it was a very big deal for that event. And we also recognize people in research and also some students. The other thing is there are scholarships that were given out to people who are going. Speaking of scholarships, can we do the whole thing in medical education? Because the Edward J. Ill Awards also celebrated medical education. And medical education, if you will, vis-a-vis the Rutgers connection, put that in perspective, because there's a lot going on in higher ed with Rutgers, medical school, and medical education.
Steve, thank you. That's really important to me. It's hard to believe we're a year into the merger now, where Rutgers has now 2 medical schools, a pharmacy school, nursing school, dental school, allied health school. That's a really big deal for the state of New Jersey. Not only the health professions, but expanding research. It will expand business and innovation in New Jersey. And that's really important for our citizens.
How so? Give us an example as to what that expansion of medical education would mean, potentially.
Sure.
In a tangible way. You and I always talk about this, like how do we break it down so that the average medical consumer says, oh, so that's what it means to me. What could it mean to a medical consumer or a consumer of medicine in New Jersey or the region?
Steve, right today, 2 hospitals in New Brunswick are working with Rutgers, Robert Wood Johnson Medical School, and with Rutgers Healthcare Institute. We're looking at the patients that go into emergency departments, about 150,000 a year. We're looking at the data. Who are they? Where do they live? What are their problems? And we're going to create new strategies so we can try to keep them well. We can cut down on readmissions to an emergency room. We can cut down on wasted healthcare resources and keep people well. By being partners with Rutgers, we can analyze that data, we can work with doctors, nurse practitioners, and design new systems of care. That's a real tangible effort of this merger into Rutgers.
It's interesting. It's not just the healthcare landscape that's changing, medical education, the landscape is changing. The other piece that's changing is very interesting. Last time you were here, you weren't in a position to officially talk about a very significant merger taking place with Somerset Medical Center. Talk about that. You are in a position to talk about that now with Robert Wood. Go ahead.
Absolutely. Thank you, Steve. In June, Somerset Medical Center merged into Robert Wood Johnson University Hospital. It's now known as Robert Wood Johnson University Hospital, Somerset. We will enhance the care that's provided in that market. There are great doctors, nurses, employees that serve that community. And by putting two great hospitals together, we can do even more. We can add value, we can add research, we can add education, specifically concentrating on the needs of the citizens. Let me give you a couple examples.
You anticipate that I always ask for examples, so you just give them anyway now. You know I'm going to ask.
Do you know, it's really important to me that we make it about the patient.
Exactly.
A gentleman was at his job in his community in Montgomery Township in Somerset County, exercising in the morning, got out of the pool, felt really weak, was taken to Somerset Medical Center. His neurologist and his cardiologist treated him quickly. They identified that he had a problem with a torn aorta, and they were able to arrange.
Oh, the aorta is the biggest. That's a huge valve, right?
Right, in the heart. Steve,
right.
I'm not a doctor.
But that's big.
It's rare. There's 7,000 aortic tears in our country in a year. His cardiologist there was able to arrange with the cardiac surgeons at Rutgers, Robert Wood Johnson Medical School, to stabilize him there, transport him to New Brunswick. He had the aorta repaired. He's now back at work in Montgomery. He's living well, doing well. He runs a health food store in Montgomery. That's what it means to people in the community.
But it's so interesting. There it is right there. So without the merger, without the collaboration, that gentleman may not have had access to that extraordinary clinical care.
He might not have. What the merger does, it lets us enhance that. We will grow cardiac care, cancer care, build orthopedic surgery in the Somerset community. It gives us the chance to do even more by partnering. And that's what's going on in the national environment.
What do you mean in the national environment?
Well, as you know, the cost of healthcare in our country is too high. So what do we do about that? We have to keep people well. We have to keep people out of hospitals by changing our focus on inpatient admissions and doing things that promote wellness, that keep people healthy in their community. And at the Robert Wood Johnson Health System and other great providers in this area, they're doing the same things, and that's what's really important.
Before I let you out of here, quick segue. The Accountable Care Organization movement, is that part of what it is as well?
It is, absolutely, Steve. We have a Medicare ACO, Accountable Care Organization, we call Robert Wood Johnson Partners, and it's in partnership with Rutgers and Rutgers Robert Wood Johnson Medical School. We serve 5,000 patients. What does it do? It looks at the data and how can we use that to improve care? How can we change what we do? Hospitals have served their communities for years, but we have to do it differently. We have to do it better. We have to improve quality and promote value.
But how's, real quick before I let you out of here, is it just a name change, an Accountable Care Organization, or is it actually a different way of doing it?
Steve, it's a system and a different way to do it. First, it starts with the data. Think about it. Great doctors all over the community. He works alone. She works alone. Nobody talks to the local pharmacy. Nobody talks to the VNA. In an accountable care organization, we put all that together. We analyze the data. We have electronic medical records. We have communications mechanisms. And those physicians are now part of a team with the pharmacies, with the VNA, with the long-term care providers. And it's designed to understand, here's what old man Jones needs, here's how we can serve him better, and here's how we can keep him well. That's very new, Steve.
And that's really accountable.
That's accountable.
Stephen Jones is the president of the Robert Wood Johnson University Hospital and the chairman of the New Jersey Hospital Association. Steve, anytime, come back and give us an update. Appreciate it.
It's great to be with you today.
Good stuff. Stay with us one-on-one. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by AmeriHealth Caritas, parent company of Perform Care, Celgene Corporation, Johnson & Johnson, New Jersey Sharing Network, NJM, Choose New Jersey, and by Community Education Centers. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.